sacroiliac pain or pelvic pain from the sacroiliac region. So the sacrum is the triangular shaped bone which is at the base of the spine. So you've got the lumbar spine, 5 vertebrae, and you've got the sacrum. At the very bottom here you've got the coccyx. People, you may have heard of coccydynia. It's a very painful situation where you can fall perhaps onto the tailbone, as it's often referred to, and that can be quite exquisitely painful. It can cause chronic pain as well. It can be quite a miserable condition. We see quite a few of these in clinic. But coming back up to the sacrum, sacroiliac joint is a joint between the iliums, which are these hip sort of fan-like structure at the side, and the sacrum itself, the sacroiliac joint. One of the frustrations we have in pure physio is that people often get diagnosed with sacroiliac joint problems or a twisted pelvis or alterations around this area. And actually there's about 2 to 3, maybe 4 millimetres of movement in these joints. They are very, very immobile. As we get older, they become less and less mobile and less of an issue. Now, in certain stages of life, they can be quite mobile. So as a young child, they're quite mobile. During pregnancy, women release a hormone called relaxin, which makes this area a bit more mobile so they can carry a child. Again, that can cause issues with the sacroiliac joint, and indeed a condition at the front here, the symphysis pubis. And symphysis pubis dysfunction is exquisitely painful, and unfortunately, some women during pregnancy and later in life can get issues there. But the sacroiliac joint is often referred to as a source of pain by lots and lots of different practitioners. I think it's very much overdiagnosed, and I'd be careful when you're hearing a diagnosis of sacroiliac joint pain that it makes sense and it is logical. If the practitioner that's telling you you've got sacroiliac joint pain, you've got twisted pelvis, can't answer your questions in a very clear and logical way, then just have a thought that there could be other alternatives to that diagnosis. In my experience, the pain is often referred from the L5, the base vertebra, L5 and S1, so this joint here, or even the bottom couple of vertebrae in the spine. And by treating and improving the mobility, strength and flexibility of the lower back, you not only improve the joint mobility around the area, but you improve the pain that travels down into the pelvis as well, the sacroiliac joint. A good assessment by an experienced musculoskeletal practitioner would be a very sensible thing to do if you're being diagnosed or suspect you've got sacroiliac joint problems. I think really have a look at the website, have a look at information, but there's no substitute in this area to having a good assessment and a clear understanding. But get your questions answered in a clear way that you understand, and that's important with this.